Oh! Oh my gosh! Holy cow! Beastly snowboarding breaks, gnarly gymnastic fractures, and other Olympic events gone terribly, terribly wrong. In honor of the Paris Olympics, today we are reacting to all the intense medical scenes and unexpected injuries from the Olympics. Let's dive right in.
This is the event back in 2012 in which he was injured and caused him to have to withdraw from the 2012 Olympic Games. Oh, just like that.
Oh no! Obviously we see a big fracture to the left lower extremity, probably a tib-fib fracture, probably a spiral component versus a comminuted fracture of this leg. So a broken bone to the leg.
Everybody turn away.
Besides obviously the broken bone, you're worried about vascular injuries because you have major blood vessels that are running down the leg and the bones get really, really sharp when they fracture. So you're concerned that they actually lacerate the arteries. You're in Rio, so you're in another country. They have different protocols in these situations. Maybe there's a language barrier, and maybe he wants to be taken care of by his own physicians. They might have this protocol to do full C-spine and spinal cord precautions in this situation. When somebody comes to the emergency department, you obviously stabilize it. We will then actually put a temporary splint there, get x-rays of it, see if it's overriding, if it's displaced, those sorts of things. With that type of fracture, it needs to be fixed with metal, unfortunately. It's not typically going to heal on its own. It needs reinforcement. Ooh, border. Whoa, 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 we got somebody losing. Oh, man. The speed and the height, I'm just thinking spinal injuries, upper thoracics, even cervical area. Oh my gosh. First thing you do, don't let this individual get up, walk. Ouch. Thank goodness wearing a helmet. You want C-spine precaution, meaning a hard C-collar or a rigid C-collar. Transport them safely, log roll them on the ground. You can put them on a hardboard just to transport, but it actually causes breakdown of tissue, but it depends on protocols. Oh! Oh my gosh! Holy cow! What do you do if you witness this? Call 911 or whatever your emergency services. Get this person to the hospital, but get them stabilized.
21-year-old Nodar Kumaratashvili of the former Soviet Republic of Georgia went over a track wall at 88 miles an hour and struck an unpadded steel pole just as he approached the finish line.
88 miles an hour. That is so fast without protection. You can fracture, destroy everything. You can crack your skull open even with a helmet like that. I've seen motorcycle accidents where somebody is going 60, 70 miles an hour, hit by a car, and even though they're wearing a helmet, just brain matter everywhere. Oh man, that is no good. Most likely this is like a hamstring pull or tear. It could be the muscle that tears. You can have the tendon that rips off. Oh, can't even use it. Just trying to finish. Good for him. A lot of times we'll see two different types of presentations. Sometimes you'll see the muscle totally balled up in one area, and that's typically due to the tendon rupture, versus if there's a muscle rupture, then you actually see a lot of bleeding. Oh. Depending on the extent of injury, do you need surgery to then tack it back down to attach the tendon back? Do you need time for it to recover? There's multiple different things at this point. And then for these type of injuries, you need an MRI. Oh. Oh! The ulna has the humerus sitting in that area and it could slip posteriorly. The quicker you can get a joint back into place, the less likely a long-term continued damage and arthritis to those joints. Zoop. Oh man, you get a better view from that. So I thought the bar caused the initial injury, but his right elbow dislocated. Elbow dislocations will cause significant amount of swelling. So again, if you could put it in faster and not have the patient wait a long time, but a lot of times you need to get an x-ray of this area first to make sure that there's no fracture.
All eyes were on her as she sprinted down the runway.
Pretty impressive, isn't it? Oh, it looks like there's already a bandage to her ankle. I think there was injuries to that ankle, including like ligamentous injury. So then the question ends up being, was it fully injured or did it get fully injured after? I don't know that.
The US had their first gold medal in the team all-around.
Wow. Having a ligamentous tear or rupture is painful, will cause a lot of swelling. There are a lot of ligaments in the feet. Typically, what I recommend to patients, it depends on the injury, obviously, ice within the first 24 hours, but then heat or ice, whatever makes you feel better thereafter. Ooh, the javelin.
She's tough, though. She'll never take a backward step. So in she comes, final attempt.
Wow.
Oh, this doesn't
Uh-oh. Somebody put it back in. Actually, that's how a lot of patients come in, holding their arm. They're holding their wrist to try to support it because you don't want it to move it.
Sails out over 55 metres, but the shoulders, I reckon she's dislocated her shoulder.
Oh, yeah. Definitely dislocated the shoulder. Most dislocations of the shoulder go anteriorly. So you have the part of the scapula, which is where the cup of the shoulder is. So it doesn't allow it to slide back. So it goes out and then gets stuck.
On the right side.
Impressive.
Oh my goodness. The original injury was a dislocation of the shoulder when she was doing some Olympic lifting in a training session in Cologne, and it looks like it's come out again.
The question ends up being, can you get right back into throwing? You're probably going to increase the risk of it dislocating again if you do it immediately. Obviously, it's not 100%. You just increase the risk. And then could you relax it, rehab it, and get back into the sport again? Yes. You just are always a little bit increased risk of having another dislocation. So it's just something to be aware of.
She's such a fierce competitor.
Seeing all these injuries really makes me think about the importance of sleep, especially for healing. For better sleep, try Do Not Disturb by Life Happens to support all phases of sleep. You can find Do Not Disturb at lifehappens.com and on Amazon.
Certainly in recent times.
Oh, whoa, that is not paint. That is fecal material. Had a bowel movement. So this definitely happens. The runs, people will say like during like long runs, stressful runs, that they may actually like poop their pants or pee themselves. Literally, the runs give you the runs.
The race coming in 8th.
Just pushing his body so much that he actually passed out. Something that we always ask individuals of like, oh, did you pass out? Do you remember the event? Did you have a seizure? Typically a seizure, you wouldn't remember the event. Passing out, you potentially would. You're still worried about a head injury because you're falling to the ground, you don't have strength, and your head is quite heavy. This was pretty intense. You get to see a lot of different injuries. Some are pretty gnarly. These athletes put their bodies through a big test, and sometimes this can happen. If you guys enjoyed this and you want to learn more, definitely check out this playlist right here. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.